So today we're presenting on Miss Bonnie McAllister, whose chief complaint today was that she's throwing up blood. So Bonnie McAllister is a middle-aged female. She elected not to share her age with me today. She presented for an internal medicine evaluation following admission for throwing up blood. The patient states that she has problems with abdominal pain for about the past week now. Her pain is very generalized and doesn't really localize well. She reports that it's crampy and sharp in nature and can be as severe as 6 out of 10 in severity and is constant. Around 2 days ago or so, the patient started vomiting, and around 1 day ago, she noticed streaks of blood in her vomit. She's not vomited since yesterday. However, she has continued to have nausea and abdominal pain. While her pain is constant, she has noted it increases after eating and lessens with fasting. She's tried Tylenol and Maalox without relief, and she's also noted that she's had dark, black, malodorous stools recently. Her last bowel movement was yesterday. She last ate yesterday, and she is not on any blood thinners. She did score a 24 on the audit score, which is significant for alcohol use disorder, and was particularly hostile when we discussed her alcohol use. She also complains of decreased urinary frequency and darker urine, and recently has gained 10 pounds in the last few months. So review of symptoms. Constitutionally, she was positive for 10 pounds of weight gain in the last month. She was negative for fevers, chills, and fatigue. Gastrointestinal, she was positive for abdominal pain, nausea, vomiting, and blood and vomit, but she was negative for diarrhea, constipation, and blood and stool. Cardiovascular, she was negative for chest pain, shortness of breath, palpitations, or leg swelling. Genitourinary, she has positive for decreased frequency and darkening of the urine. However, she was negative for urgency, blood in urine, or pain with urination. Past medical history, she is a controlled hypothyroidism for the past 2 years. Surgical history, she had an appendectomy at the age of 21, cholecystectomy at age 35, and hernia repair 4 years ago. She had a partial hysterectomy around 1 year ago, and all of those procedures were done without complications. Medication-wise, she's on levothyroxine, acetaminophen, and bismuth subsalicate. Allergies, she does have a penicillin allergy. Her reaction is hives. We did ask a little bit about her immunizations. They are up to date. Her family history, her mother has hypothyroidism. Her father had a heart attack around the age she is now. Her sister is hypertensive, and she has 2 healthy children. Her social history, she denied any tobacco or recreational drug use, but it did seem like she was a relatively heavy alcohol user. She confided in me she drinks around 4 to 5 beers daily, sometimes more, and her audit score was 24, which indicates alcohol use disorder. And I tried to discuss this with the patient further, did some motivational interviewing, but she was very hostile during our brief conversation and did not want to discuss it at all. Physical exam-wise, her vitals, blood pressure was 112 over 68 millimeters mercury, which is a little bit low. Temperature was 98.6. Respiratory rate was 14, a little bit low, and her heart rate was 99. Constitutionally, she was nauseous, but didn't have any diaphoresis. Heat exam, sclera was anecteric. Her oral mucosa was dry, without erythema or exudates in the oral pharynx. Pulmonary, her thorax was symmetric with good expansion. Lungs were resonant to percussion. Breath sounds were vesicular. There was no rales, wheezes, or rhonchi. And diaphragms descended 4 centimeters bilaterally. Cardiac exam, she had normal S1 and S2 to auscultation. There were no murmurs or extra sounds. Abdominal exam, her abdomen was protuberant with active bowel sounds. It was soft with a little bit of tenderness in the epigastric region. There were no palpable masses or any evidence of hepatosplenomegaly. Liver span was 7 centimeters in the right midclavicular line. The edge was smooth and palpable 1 centimeter below the right costal margin. The spleen and kidneys were not felt, and there was no CVA tenderness. So in summary, Bobby McAllister is a middle-aged female with a history of alcohol abuse and cholecystectomy who presents complaining of 1 week of abdominal pain, which worsens postprandially with hematemesis. She has hypokalemia, leukocytosis, and elevated liver enzymes and BUN. So for her problem list, I'd say she has elevated liver enzymes, abdominal pain, hematemesis, hypotension, hypokalemia, leukocytosis, hypothyroidism, and heavy alcohol use. For those, my differential diagnosis was gastric ulcer, squamous cell carcinoma of the esophagus, alcoholism, alcoholic hepatitis, or acute viral hepatitis. So recommendations today include getting an EGD to evaluate for gastric ulcer versus squamous cell carcinoma. And for now, we'll start her on metronidazole, omeprazole, bismuth subsalicate, clarithromycin, and IV fluids to manage risk for ulcer and hypertension. We'll also continue to monitor her liver enzymes and hope for improvement. She'll remain on her levothyroxine, but we'll discontinue the acetaminophen and Maalox. Thank you.